medical radioisotopes and radioactive tracers. Summary. Radioisotopes are radioactive isotopes. They have an unstable nucleus, several unstable and artificial radioactive isotopes. They have medical uses. Energy may be liberated mostly in the form of alpha, helium nuclei, beta, electrons or positrons, or gamma electromagnetic energy rays.
Doctors use medical radioisotopes to diagnose patients. They do this by radioisotopes breaking up the DNA and waves of energy reading the body. Some ideal radioisotopes are technetium 99, which is used for skeleton and heart imaging. This is the most used medical radioisotope. Another one is iodine 123, and it's ideal for the treatment and diagnosis of cancer. The last is sodium 24, and it's used by doctors and scientists to test the circulation of blood in the body. Also, waves of alpha, beta, and gamma rays are released. Medical radioisotopes have improved over time. For example, government has invested in science and technology, and because of that, nuclear medicine procedures have been further developed. Going off of that, nuclear medicine can now deliver targeted treatments to those who need it. The overall usage of nuclear medicine procedures is expanding rapidly. Nearly 20 million nuclear medicine procedures using radiopharmaceuticals and imaging instruments are carried out annually in the United States alone.
Pros and cons of this technology. So the pros, it doesn't require surgery because you're just getting it inserted. You don't require any cuts. And leading off of that, there are no infections. Sometimes during surgery, something can get infected, but since it doesn't require surgery, there are no infections. And it helps in the treatment of diagnosis of cancer such as leukemia and tumors. But there are cons to it, so it ruins tissue leading to skin burns. It's also really expensive and it causes genetic mutations. Cancer cells can also develop if an excess of radioisotopes are used. And then right here on the top is radioactive isotopes and how they applicated into medicine. And then the bottom is for diagnosis what radioisotopes they use, and then for the therapy what radioisotopes they use. Who originally discovered or designed this, and how did they come up with it? When? So radioactivity was first discovered in 1896 by a French physicist, Antoine Henry Becquerel. It was an accident, and he noticed that certain atoms were capable of self-disintegration. One of the minerals he worked with was uranium, and then in 1903, he was awarded the Nobel Prize for Physics for his discovery. The first medical radioisotopes was used in 1939. This was phosphorus 32. And then right here is a picture of Antoine Henry. And these are our citations.